And we're back, and my special guest today is Mr. Mark McCroskey. He is the Vice President for Ancillary Services and also for Development here at Tahlequah City Hospital. Thanks for joining us today.
Thanks, Jerry.
Appreciate you coming in, and what an exciting time for Tahlequah City Hospital. So much going on. In recent weeks, as I drive by and see the cranes out there and steel being placed and now the building being finished, tell the people of the area what's going on here at Tahlequah City Hospital in this construction.
Absolutely. Well, it is exciting. I mean, we have a robust, we're in a growth mode right now, and the new building right behind the hospital is going to house a new dialysis center and physician offices, as well as administrative building offices as well. And so it's just really growing leaps and bounds, and the community's going to benefit from that.
There's a lot of activity in the Tahlequah City Hospital organization as far as a lot of new physicians, a lot of new specialties in care that we really haven't had to this level in our local hospital in previous years. And it's really an exciting advancement, I think, as a regional health center. And tell us how the Tahlequah City Hospital is now really a regional health center.
Oh, you're so right, Jerry. The hospital has become a regional medical center because it has a lot of the specialties that you would find in a larger metropolitan city, and cardiac and nephrology and orthopedics and spine specialties, pain management, etc. We're blessed to have that right here in our community, and that is really a great thing for everyone.
Well, I know one of the things that in conversation with you and Brian Woodliff, that there's a real concerted effort to develop, continuous effort to develop the recruitment of new doctors, primary care, specialty care, so that the people in the community are connected through a healthcare system into the city hospital. And tell us how that benefits the whole community.
Oh, that is absolutely correct. The partnerships and the joint ventures to bring in these specialty physicians and services is on an ongoing platform, so that we can bring service, big city services, health services to a rural setting. And so we do that through, there's lots of exciting things going on with NSU and Cherokee Nation, and we just are really excited about those opportunities.
Well, I know in a different century, about 30 plus years ago when I was on the hospital board, it was a new and kind of exciting time in advanced health care in the community, and we'd really grown. It located into the new facility just a couple of years earlier. Hastings was coming on in their new facility.
Right.
So the whole landscape of healthcare has really changed. And it's not about buildings. It's about the men and women, our doctors, our nurses, our medical technicians, the people that really support those health needs. Tell us a little bit about the team approach that's so exciting at Tahlequah City Hospital.
Well, that is the core of what we're about. It is the patient and the families, and having the specialty physicians and the ability to service the community healthcare needs is paramount in our organization. So we run into people in the grocery stores and the restaurants, and it's just a big family, and we really try to set ourselves apart from a lot of other facilities, just because they're big, and we're rural America, and we are small, and we're family. So,
well, I know at NSU we're real excited about a lot of the work we've been doing the last 2 or 3 years on expansion of our health professions, providing students career paths in healthcare, and we know it's so important as we're hitting a really high demand, a big shortage for not just doctors, but nurses and medical technicians and occupational therapists and all the fields, that we're real excited and so appreciative of you and Brian and Woodliff and all those associated with Tahlequah City Hospital to be working proactively with us to help be a part, allow NSU to be a part of the solution to this challenge.
We are excited to partner with NSU, and just like you'd mentioned, the population is aging, and so there's the baby boomers, and so just like you mentioned, Jerry, the need for healthcare professionals is growing exponentially. So having the ability to have that locally to tap into to have those resources available is just awesome.
Well, I know that one of the areas that I'm aware that you and Brian have been working on are medical internships and bringing kind of a full circle to people out of the academic side into the clinical rotations and proactively seeking those people. And as a community, we're doing all we can when they're here to make them feel welcome and be interested in staying to be a continuous part of the community.
Sure. I mean, we have a great quality of life here. And I think that is what draws people to live here and become embedded in the community. And, you know, for instance, the OSU residency program, we are so blessed to have that opportunity here. We have 5 new residents. They started July 1, and we've met with them, and they're great folks that typically, for the most part, grew up in this area and just want to come back home. And so we're real excited about that.
Well, it allows for a great future that we know that some of these medical career paths are going to lead back to Tahlequah, even if they're leaving to go to OU or OSU or some other medical institution.
Yeah, that's right.
If you could wrap up, we just got about a minute left. What is the overriding philosophy of Tahlequah City Hospital in its outreach to this community?
Well, I think it's broad, but yet it's very specific in that the leadership and everyone from the board of directors to the physicians to the staff is we want to do the right thing for the right reason. And kind of our branding is that TCH cares. And we care about the community, we care about the health care for this community, and we want to be a resource that people can call on when they need us.
Well, I think it's obvious that there's a vision that's being shared all the way from the top down among the administration and certainly the board. When I was mayor of Tahlequah, I enjoyed working with the board and helping many of them be appointed to this board, and they've done a marvelous job. And we thank them for it. It's sacrificial, the service. They're volunteers. They are not paid a dime. Lots of hours and capital, human capital investment in their time in this great hospital, and it shows.
That is absolutely correct. We're blessed.
Well, thanks a lot for having us out today, and we need to have you back on the program sometime soon. We'll catch up once they open up the new section.
Awesome. Thank you.
Thank you. And we'll be right back.